More than 100 Democratic lawmakers are co-sponsoring a new House bill to dramatically revamp health care in the United States by creating a Medicare for All system funded by the federal government. This comes at a time when as many as 30 million Americans have no health insurance and tens of millions more are either underinsured or struggling to pay their health insurance premiums. Democratic Congress member Pramila Jayapal of Washington announced the bill last week.
It is time to ensure that health care is a right and not a privilege, guaranteed to every person in our country. It is time for Medicare for all. Is this a bold and ambitious plan? Yeah. Damn straight it is. Because it has to be. The scale of our health care crisis is enormous, and our plan has to tackle the deep sickness within our for-profit system.
Congressmember Jayapal's bill would expand Medicare to include dental, vision, and long-term care, while making the federally run health program available to all Americans. It would eliminate health insurance premiums, co-payments, and deductibles, while changing how health care providers are paid.
Robert Weissman, president of Public Citizen, says the legislation would eliminate nearly $500 billion in waste spent annually on bureaucracy, inefficiency, and excessive corporate profits. Political observers say the bill is largely symbolic, given the Republican-held Senate and White House, but will likely play a major role in the 2020 presidential race.
So my plan says, let's take the existing, very successful Medicare system that already exists for seniors. Let's expand the kind of coverage that it offers, because that's the biggest complaint about Medicare, is it doesn't cover things like dental, vision, mental health, substance abuse, some of those critical pieces. And then let's extend it to everyone in the country. Same doctors and hospitals, but you would actually be able to choose and not be limited by insurance companies that say this hospital is in-network, that hospital is out-of-network, those kinds of issues. And you won't have to have 5 different insurance plans. So what we do is we say the government is going to pay for all of this. And in the end, we want to make sure we're containing the cost. So we change the way that hospitals are paid. We take on pharmaceutical drug pricing, because that is a huge issue. We negotiate now. We allow the Medicare system to negotiate, just as the VA does. And we, for the first time, include long-term services and supports, which is very important for our community that has disabilities and our elders who simply cannot afford to live with dignity.
Well, Congressmember, right now, most Americans who do have health insurance, their health insurance is paid for either by the premiums they pay out of their paychecks every week, or that their employers pay, sometimes a combination of both. How would the funding of the system change under Medicare for All?
Right now, the federal government already pays for about 2/3 of the total health care costs, because we have Medicaid and Medicare, which are already part of the federal system. The rest of it is either people who have nothing or people who are covered by employer health care. What we are saying is that there's about $600 billion that employers are paying for their health care for their employees. That money, just a portion of that, could come towards the single-payer system, because these for-profit insurance companies are continuing to hike up premiums, not only for families, but also for the employers. So enormous amounts of waste that are going towards a for-profit insurance system that is more interested in their profit than patients. This is a big plan. It's an important plan. And really, it's about saying healthcare is a human right. It needs to be available to everybody, not just to the wealthiest, because, as you said, 30 million Americans who are uninsured, and then on top of that, at least 40 million who are underinsured, can't pay their premiums, don't get the care they need. 1 in 5 Americans that literally does not take their pharmaceutical drugs that they are prescribed because they can't afford them. You know, the United Health CEO is making $82 million in take-home salary, profit. All of these CEOs are making enormous amounts of money, and pharmaceutical drugs and simple procedures cost so much more in the United States than anywhere else. Why is it that the Medicare system pays more for prescription drugs than the VA. It's because the pharmaceutical industry, when this provision was up for Medicare to be able to negotiate for lower drug prices, the pharmaceutical industry put over $100 million into lobbying the federal government to make sure that that could never happen. So basic things like negotiating for prescription drug prices, cost containment, universal coverage. If you're sick, go to the doctor. We want you to go when you start to get sick, not when you're so sick that you have to go to the emergency room and it costs us so much more. Physicians are with us, largest labor backing that we've ever had in the history of this bill. And I think it's making a real difference for people to know that we are ready to fight the industry lobby that's out there that Alex Azar and others want to, continue to support. The Democratic caucus is united around making sure we shore up the Affordable Care Act right now. We do have to fix what Republicans have stripped away, even from that accomplishment. However, I do not think that you can really guarantee universal coverage to everybody and contain costs by nibbling around the edges. And with lots of respect to my colleagues who are, just trying to expand Medicare, buy-in at 50, things like that, that is not going to accomplish the deep sickness of our for-profit healthcare system. We have to take that on if we are going to provide universal coverage. And Medicare for All is really the only plan that does that. As I said earlier, this is the first time we're including long-term supports in our Medicare for All bill. And that is also very important. If you look at the statistics around this community that has disabilities, our elders who literally are not getting the care they need unless they get so poor that they have to go on Medicaid. And then in that case, it's institutionalized care that's the default. We need to allow our folks with disabilities and our seniors to be able to get good care in their homes and in their communities. So our bill also switches the focus from institutionalized care as the default to home care, which is significantly cheaper than institutionalized care.
In his 2000 book called The America We Deserve, Trump wrote, "I'm a conservative on most issues, but a liberal on this one. We should not hear so many stories of families ruined by health care expenses. We must not allow citizens with medical problems to go untreated because of financial problems or red tape. The Canadian plan also helps Canadians live longer and healthier than America. We need as a nation to re-examine the single-payer plan, as many individual states are doing."
There are lots of people who are not liberal Democrats who believe that this is the right thing to do. At our press conference, we also had a series of employers who are part of a business coalition for Medicare for All who talked about the incredible amount of money that employers are spending for really good plans, sometimes $35,000 per employee. And so they did the math and said, you know what, this is a drain on our competitiveness, our ability to compete in the global economy when we're paying this much for healthcare. We would be happy to just pay a portion of that towards the federal government insuring, take the waste out of the insurance company system, and bring the costs down and be able to provide comprehensive care. So I actually think this is a plan that unites Republicans, Democrats, and independents. It's certainly what the polling shows, that people are with us on this. And I think that Donald Trump is reflecting in that book the reality. The truth is, if we want to provide universal care, this is not a radical idea. Almost every industrialized country in the world already does it. They're paying half the cost of what the United States is paying, and their outcomes are so much better, and they are more competitive because this system is being provided by the government as it should be.
Congress member, the issue of the insurance companies, you're talking here about putting the health insurance industry essentially out of business. What would it take to be able to get this kind of legislation passed, given what was sure to be a life and death struggle by the insurance industry to bankroll hundreds of millions of dollars to stop this?
Well, we don't say that insurance companies can't exist. We just say, it's same as Medicare, that you can't provide duplicative coverage. So an insurance company can't have a plan that provides the same thing that is in our Medicare plan. Now, if insurance companies want to come up with other plans that are beyond the scope of the services that are provided under Medicare for All, they are free to do that. So they would have to rejigger themselves. And obviously, we have expanded the range of benefits that are provided. So we think it's pretty comprehensive care. They won't have the space to provide certain things like vision, dental through Medicare Advantage because those will be incorporated. So yes, they will have to rejigger themselves. But we know that they are going to pour, I'm sure, hundreds of millions of dollars into trying to defeat this plan. And just the talking points that you've already mentioned are out there. But what we have with us is the American people. We have people who have family members who have died because they can't afford their cancer treatments, people who can't get insulin treatments and they have died, people who literally are in the hospitals with bills that are $20,000, $30,000 because they went to an out-of-network provider, people who are trying to decide between paying rent and paying for their medical treatments, people who are foreclosing on their homes, people who are going to GoFundMe campaigns as their primary insurance plan. Americans across this country know that is unsustainable. It is the single biggest issue for Americans, red states, blue states, rural, urban, you name it. So the stress on people when they go to bed every night and wake up every morning, I think, is the thing that we have that will counter all the hundreds of millions of dollars that are out there. And then allowing people to really understand what they're getting is going to be very important, which is why your coverage and other people's coverage is essential, because they will try to tell a lot of lies, and we need to get the truth out there about what this plan is.